Hey folks, Dr. Walker from denwalker.com. Welcome back to the channel. Today I talk a little about pernicious anemia. And as you well know about most anemias, they can make you fatigued and muscle aches and muscle pain and just weakness in general, fatigued in general, right? But this is a little different. So the pernicious anemia is really an issue with B12 being absorbed. B12 is one of those supplements I talk about a lot that, again, help you with so many things, specifically nerve disorders, right? It helps prevent nerve disorders, and you get your B12 from a lot of food. We mentioned before some seafood, a lot of seafood, mackerel, for example, or salmon. Really good foods for B12 supplementation, but you have to have the stomach requirement to extract the B12 from the food, and you get it absorbed by your system long term. But there are certain things that we take, and I want to talk about two of them. There's a lot of them, but I want to talk really about two things that cause us a problem, and we all know about this. Physicians, providers, they all know about this, and it baffles me a lot in what we do not do for patients that we know run the risk of disorder. And so as you get older, obviously, you need that support. You need support all throughout your life, but specifically, as you get older and you're on multiple medications, you want to be certain that your B12 levels are adequate. You want to be certain that your red cells have the required amount of things to help transport oxygen to your tissues and so forth, so you're fine. But there are two medications that are well known in being causative for being problematic in creating or having enough B12. Number one are proton pump inhibitors, PPIs, they're called. So the Protonix, Prevacid, Prilosec, those things. And the other one is metformin. So they'll go back and forth in terms of what they think is the cause of it with those medications. For example, metformin, the thought is that it prevents the intrinsic factors from being created by the parietal cells of the stomach, cells in the stomach essentially. It prevents them from being created, and so when you do have B12 coming in through the GI system, there isn't enough of the intrinsic factor to bind it, essentially to send it downstream for it to be absorbed. So there isn't enough of that factor in and of itself. And then the other one, again, proton pump inhibitors. And those are typically used for things like reflux and GERD and so forth. And what they do, I mentioned it before, what they do, those drugs, they tend to increase the pH of the stomach. Now, you need a low pH, about 1.5 or so, to extract, again, the B12 from the food that you've eaten. So now we have a condition where the pH of the stomach goes from like 1.5, which is kind of where it lives, up to about 6. Now, as I said before, there isn't many things that will get absorbed by your body with a pH in your stomach at 6. Now, what your doctor will always tell you is, before you have your food, go and take this proton pump inhibitor, or have it with your meal and all those things, right? So it literally defeats the purpose of the body of doing its job. So again, calcium, for example, need low pH, B12 need low pH. Those things that need to be extracted from the food need to have a low pH. And so when you take a proton pump inhibitor with your food, right before your meal, in fact, you can't, or it makes it very difficult to extract the nutrients from your food that you need for nutrition, right? It makes it very difficult. Now, back in the day, we used to check your B12 levels sort of in conjunction with those things. When you have metformin, you're on PPI, they would check your levels, your B12 levels, to be certain it's not too low. Somehow we moved away from that. I don't know when and how and why, but we moved away from that. Perhaps intentional, I don't know. More things I'm reading, I'm thinking that many of these things are done intentionally to cause problems long term, because they do not now serially check your B12 levels when you're on PPIs, short-term, long-term, or metformin, short-term, long-term. It doesn't make a difference. They do not typically check them anymore until you come in with B12 problems, right? B12 disorder. Then they go, oh, you've been on PPI for all these years, let me go and check your B12, and oh my God, it's actually low, right? So it's crazy, right? So when you come in now, you can't focus, you have peripheral nerve disorder, you have balance issues, you have focusing issues, you can't sleep, you have muscle weakness, you have muscle wasting, you have tremors, right? Then they'll check you, right? And that's a very long term long time of not having adequate B12 for you to have that disorder, right? But then they'll treat you, right? They'll treat you now with giving you B12. So again, it'll take your body essentially years sometimes to get to those conditions where you're having tremors and weakness and whatever else. The point though is we shouldn't do that, right? We should not have to wait that long before we check your B12 levels to say, hey, B12 is low, and you've been on PPI, and you've been on metformin, right? You've been on all these things, right? And now we'll check your levels years down the road. Again, makes no sense to me. And here is the worst part of it. Here's the worst part of it. When we find out that your B12 levels are low, right? They do not typically give you the active form of the B12 cobalamin. They do not typically give you that active form. They give you sort of the version that needs to be first changed into the active form. They give you cyanocobalamin. Cyanocobalamin that I mentioned before breaks down into some components of cyanide, right? So they give you that version. They give it to you sometimes in injection. They give you some in pills as well, but they'll give you that version of B12, which I think is problematic. I know it's problematic long term because it breaks down into cyanide and cobalamin. That's what it does, right? As opposed to giving you the active version of the cobalamin, the methylcobalamin, right? Which I'm recommending for folks, right? So I'm telling you, I've been saying this for years now. If you're taking B12 supplement, and I don't know why you wouldn't be, if you're taking a B12 supplement, the one that you should take is the active. Just go with that. It is the active version of the B12, the methylcobalamin. You can put that. It's a sublingual thing. Bypass the whole stomach part, right? You put it on your tongue, it melts on your tongue, and it gets absorbed that way, right? That is the best version of this thing, not the cyanocobalamin, right? And you can also they do have still an injectable version of methylcobalamin. They do. But I promise you, when you get to your doctor and they say, oh, by the way, your B12 levels are low, we're going to give you a shot. They never, ever, ever give you the the natural version, not the synthetic version. Synthetic version is the cyanocobalamin. The natural version is methylcobalamin, right? They never, ever give you the natural active version. They always give you the cyanocobalamin. The question is why? Why do you not use the active natural version, which absorbs better than the synthetic version? But yet they always give you that anyway. But I can't tell you, Dr. Walker can't tell you stop your metformin or your PPI. I can't tell you that, right? That's a discussion with you and your doctor. But what I would recommend that you do is if you're on those medications, and I'll put some more in the chat here in a second. But if they do have you on those medications, PPIs and metformin, it behooves you to ask them to take a look at your B12 levels to see where they are, right? And if they're going to give you, let's say they're not stopping your PPI and metformin, they're probably not going to do that, right? Then it behooves you to take it on yourself and just have a discussion with them to take the sublingual under your tongue, methylated active version methylcobalamin under your tongue, and they can do that. Or if they're going to give you the shot, simply request, because they will not initially give you the methylated version. You have to ask them, can I, instead of getting the cyanocobalamin, can I please have the methylcobalamin? Anyway, thanks for listening, Dr. Walker. Have a great day.